So let's talk about heart disease. Problem with heart disease is your heart sits here, it's got 4 parts to it, and you've got a big blood vessel that goes out the top, which is your aorta, and you've got a blood vessel that comes in, which is your one of the big veins. And your blood vessels that supply your heart come out of your aorta and travel around on either side, around the front and the back. The big pump part of your heart is this one here. This is your left ventricle, and what that does is pushes all the blood up and through your aorta and into your body. And what we worry about when it comes to cardiovascular disease is the size of these arteries. So if we look at the size of an artery, when you look at a tube like this, the amount of blood that can flow through and out the other side depends on how big that diameter is. And the things that change that diameter are all the things that we talk about in relation to heart disease, which are smoking, diabetes, exercise, blood pressure and cholesterol. So what does all of those things do to this size of this blood vessel? So if you think about it just as a circle to start off with, what happens with blood pressure is that when you have high blood pressure, you get damage on the inside of these blood vessels. And I always talk about it like if you have a little trickly stream going down a hill, it will cause not much damage, but if you have a big torrent, it will erode away a mountain. So big fast flow causes harm on the other insides of your blood vessels. When you get that sort of harm, cholesterol will deposit into those areas to try and help with the healing process, and there'll be a bit of inflammation as well that goes on. So that's all right if your cholesterol's low, but if your cholesterol is high, you get larger deposits in here. So now if you can see from this, we've now shrunk that size of that blood vessel down to that. The problem with that is that area out here is actually quite a lot of blood. And so your heart now has got a significantly reduced amount of blood going to it. The other things that cause trouble are diabetes. So diabetes shrinks down your blood vessel and causes trouble, makes them stiffer so they aren't as elastic. Smoking shrinks down your blood vessel as well. So if you have all of these things, so you've got high cholesterol, and then you've got your smoking, and then you develop diabetes on top of that, your blood vessel in your poor old heart has now got that amount of flow when it could have had all of that. So the important factors are that we work on are your blood pressure and getting that down, your cholesterol and reducing that as well, and trying to avoid diabetes. The other things that we talk about are your exercise and your weight. Now, the two things about exercise and weight are that if you're exercising, you're making your heart fitter. So your heart's like any muscle. It wants to do what it is made to do. And your heart's made to beat and pump blood around your system. But that's what it normally would do anyway. And like any muscle on your arm or your leg, it might hold your bones together. But that's what it would normally do. And making it fitter means that you have to exercise it. So to make your heart fitter and therefore healthier and increase the blood supply to different areas and to help make it sort of resilient to any lack of blood supply, then exercising is the most important thing because it gets your heart rate up, it makes it more robust. In relation to your weight and how that has an impact is that if you've got a big body out here that all this blood is going into, your heart has to push harder to get it into that bigger body. Whereas if you've got a small body out here, your heart doesn't have to work too hard getting that flow out to there. So if your heart's pumping lots of blood around a larger body in a larger area, then that's going to cause it to work harder. And if you can slim down, get a bit of weight off, it will make a big difference. And the other thing that makes a big difference in having your weight go down is with your blood pressure. They say that a few kilos of weight loss will change your blood pressure quite considerably. So it's worthwhile getting out, getting some exercise and losing a bit of weight. The one thing that we know is the biggest thing that's worth working on is your blood pressure, because that's if we can keep that down, then it means that your heart's not working so hard, that there's not so much damage going on and all those sorts of things. And the way you can impact your blood pressure is certainly with getting your weight down and with getting your exercise up. So these two have a big impact on that one, along with various other things.